Well, we've talked about just about every part of the body. One we haven't talked about in a long time, if ever, specifically tummies.
Tummy trouble.
Tummy trouble. Yeah.
Tummy trouble. Yeah.
Right.
Well, and this is a very common presentation for us, and we get missteps on both sides of the equation on this. When do I bring them in? And I have the ones that, I mean, if the dog breaks wind, dog doesn't normally do it, bring it right in. And then we got the ones that have been vomiting, having diarrhea for a week, and they finally decided to bring them in. So there's missteps on both sides. So what I want to talk about today is what is considered kind of acceptable. Because remember, garbage in, garbage out. So yes, if your dog gets in the garbage and eats spoiled food, it's normal and customary to expect some vomiting and diarrhea.
Yeah.
You may not, but it wouldn't surprise me a bit. People come in, well, the dog's vomiting. I said, well, has the dog been in the garbage? Yeah, he got in the garbage yesterday. I wonder what's going on. What do you think? Okay. And so it's typical. This is a typical progression. This kind of helps you with your thought process, whether you get them examined or not. Is it so? If I take an insult, and we'll make this insult, okay, a single entity, and the dog eats this insult, so it's in the stomach. So what's the first symptom we're probably going to see?
Probably going to smell something that's not right.
Right, but what will the dog be doing? Probably if it's in the stomach.
Yeah.
They'll throw up. Yeah. Okay. So the throw up starts. So that usually precedes it, and then as that moves south, then what do the symptoms become?
The other side.
That's exactly
diarrhea.
right. So then what happens, you got vomiting to begin with, and then diarrhea picks in, the vomiting phases out, and then it goes on out. That typical progression lasts about 3 days.
Okay.
Okay? And because, again, too, when you insult the intestines, okay, it takes about 3 to 4 days for that mucosa to reline itself and fix. Okay? So atypical, if you know your dog ate something it shouldn't have, and as long as they're not becoming significantly dehydrated, watching and waiting for 3 days is reasonable. Now,
Okay.
if you've got profound projectile vomiting or diarrhea, that's a different story, and that's where common sense comes in. If you see blood in either one of those, that's another common sense thing. You need to immediately get them on in. But first thing you should do if you got a vomiting dog is withhold all food, okay, for at least 12 to 24 hours, water only.
Yeah.
Okay, no food. I can't tell you how many times people get panicked and they said, well, he wouldn't eat, so I got him some bacon or cottage cheese. And it's like, really?
Why would you do that?
Yeah, why would you do? Why don't you just give him some Limburger cheese and really make him throw? But the point is that resting the digestive tract is just like spraining your ankle.
Yeah.
If you sprain your ankle, stay off it. If you've sprained your digestive tract, stay off it for 12 to 24 hours. Okay, that's what we call NPO. But
as long as the drink is there, that's...
As long as we got water coming in, we're good. Anything that progresses beyond 48 hours, when you're getting into that third day, if it's still significant, and as always, if you're concerned, get them checked.
Sure.
But those are some guidelines that you can use to kind of help, you make a decision, do I need to go in or not? And like I said, 1 or 2 vomit episodes and then followed by some diarrhea the next day doesn't get me super excited.
Now, before we go, real quick, a lot of people listen to us on the radio, and that's great, but you can see us. Tell them how they can actually see our little happy faces.
Do we really want to do that?
Sure, go ahead.
All right. Yeah, if you go to our Facebook page or our YouTube channel, basically these are all recorded. And so if you find one of these that you do like, you can always go to YouTube and go ahead and bring up the old ones and share them with people, family members. For instance, with this tummy trouble one, if you know somebody that could use that, go ahead and share that with them and send it to them. And basically everything that you're hearing, unfortunately, you see us in it, which maybe is not a good thing.
Well, you can hear us, you don't have to look.
Well, my oldest son says I have a face for radio, so that. But yeah, so either on our Facebook page or on the YouTube channel.
Now, as time goes on, do the older ones just go away, or you're just building them more?
They're just building up more and more and more. So that's actually we've got a pretty good extensive library now. Probably, producer, how many we got?
A lot.
6, 8 months.
6 or 8 months worth, yeah. So
Probably.
times 4, so yeah. So we've got probably 30-something videos on there too.
And growing all the time.
And upcoming, we're planning on doing some how-tos. Because people ask us how to do ear cleaning and stuff like that. So we may put some of those on there. And as those pop up, we'll talk. What we may do is do some companion talks on pet tips and direct them that way.
We could bring a little pup in here, maybe show a little ear cleaning and whatever.
You remember last time we did that?